Hello, Eddie.
Good afternoon, Governor.
Good afternoon. Good afternoon to everyone. It is good to be in Northwest Arkansas for our daily COVID-19 update. I have preceded this briefing today by first going to Siloam Springs, where Secretary Preston and I went through the Lazy Boy facility, in which they're adding 125 new jobs there in Siloam Springs. So it's a sign of growing demand and economic growth in our region. But it is also instructive to see the fact that all of the workers there, as required, long before I put in the mask mandate statewide, that all of the workers in the factory setting were wearing masks. And they were doing that as a matter of company policy, and they were doing it through the manufacturing process. And that's just an example of where businesses are taking it very seriously, what they can do to stop the spread of the virus. We came here to Washington Regional Medical Center, and I want to thank Larry Shackelford for his hosting the community here. But I first got to meet with, at my request, some medical providers, nurses, and doctors who are on the front line dealing with COVID-19 patients here in the hospital. And I just wanted the opportunity to thank them as healthcare workers for what they're doing. And I just want everybody to know that I could see a lot of exhaustion and stress on their face. And the stress of dealing with very seriously ill patients, watching some of them pass away in very lonely circumstances, it takes a toll on you emotionally. And I just wanted to thank them for what they're doing to save lives and the difference they're making. And they are doing that. I also listened to them in terms of what they had to say to me and what I could learn from them as far as dealing with the future. But I'm grateful for the opportunity to visit with them and to thank them. And then, as is our custom, we met with our community leaders here, as many that could fit into a room and still be socially distanced. But we talked about the economy and what is needed here and how we're growing. But we also had both Springdale and Fayetteville school districts there brief me on their plans to return to school the week of August 24th and the excitement about it, but also the concerns that they naturally have and things that we can address. We also visited, of course, with our hospital administrators and learned a little bit about their cases and what they're dealing with and the pressure that might be on them and how we can help. And I'm delighted that I mentioned Larry Shackelford that is here with Washington Regional Medical Center, but also Eric Penalto with Mercy Health Centers out of Rogers, a longtime friend. And I asked them both to give a brief report today. I mentioned Secretary Preston. He'll have some comments in terms of the economy and some important information for the public. And then always a pleasure to be joined by my partner, Dr. Jose Romero of the Department of Health. Let me first go to our cases. And yesterday, we had 591 new COVID-19 cases across the state. This is down, of course, from the previous day of 728. I will put a little asterisk there that I'll come back to in a little bit. The even better news is the hospitalizations. Yesterday, we were at 488 hospitalizations, and those are down 14. That's 474. In terms of deaths, we've had 6 additional Arkansans that have succumbed to this virus, and that leaves our total at 380 through the course of this pandemic. Our testing, and that's the asterisk, was down a little bit, 3,933 tests. Some of those will be brought into the system in the coming days, so we'll see whether that has any impact on it. But we'll talk about that a little bit more when we see it on the graphs. In terms of our counties, the top counties in terms of new cases was Pulaski County with 80 new cases, Benton County with 46, Washington County right here, 38 new cases, Craighead County 33, Faulkner County 30, Garland County 30, Pope County 24, and Crittenden County 22. So a wide diversity of counties across the state that had more than 20. The rest had fewer than 20. Let's go to the graphs so we can see this in a different way. There's a screen back there I see as well, in case anybody can see that better. But as you see on the graph, the new cases, and here you can see that we only had a few cases that were in a correctional. The rest were in our community. And of course, that's down, and you can see the trend line with the next one, which is the 7-day rolling average. And you can see we're in a little bit better position than we have been. And then if you'll go to the active cases, and this is good news because the active cases are down 2 days in a row. And then if you'll go to the next one, it is the hospitalized patients. And here again, we're down today, we were up yesterday, so it's floating right there around the same level, but we'll have a better report from the hospital administrators here shortly. The rolling average, 7-day rolling average of percent positive cases, these are of all the tests, those that might be positive, and here you can see that our rolling average was above 10%. Now we're down below the 10% CDC recommended level, and some of those late percentages might be corrected, but at least we're on the right trend line there in terms of positivity of cases. And this is, explains a little bit in terms of our the testing facility type and where we are in our testing. I've remarked in previous days that our commercial lab testing has not been producing the numbers that we're accustomed to, and so that brings our whole number down. We're doing what we can to push that, but as you know, that's a demand that is a nationwide issue and not just an Arkansas issue. We did have, as you can see, a reduction in the number of tests from our Department of Health lab. Dr. Romero checked on that, and it was a entry challenge that we had. Those will be entered probably in the coming days, and so that's a little bit of the explanation. Even though that's still a pretty good day in testing, it's not the way it's been. And then if you go to the Northwest region, and that's our custom as we come out from Little Rock, we want to look at the different regions of the state, and so today we'll just look at the Northwest region for a moment, and this is a beginning, I should say it's a beginning success story. It's not a completed success story. But you can see in the 7-day rolling average of new cases where we reached our peak, I guess it was about a month ago, and since then it's been on the decline, and that is a success story even though we still want it to come down lower as we get ready for school. But why has that happened? It's because everybody here in Northwest Arkansas has worked together as a team. We've worn masks, we have done our contact tracing, we've done our social discipline, we understand what's at risk, and so everybody took it seriously and is trying to get the job done. And so let's continue down that path. And then continuing on in the Northwest region, the other part of the success stories are our hospitalizations. And here we were very, very worried because I've talked to the hospital administrators, and they were being kind, but they said it's tight. And I asked about the capacity, and they said, well, it's tight, or we're close. And we were close, but we've seen that decline, which means we have additional hospital space that's available. That's good news. And then this is by all the regions of the state, and you know, I caution you not to take the last dip too comforting, because we have had a decline in our testing capacity that might impact that some. But it's still, you can see the high one is in the central region, that we've had some decline in cases there. And you can see in each of the regions it's either flat or it has a slight downward trend, but we're going to keep an eye on that, not taking that for granted or expecting that to be a longer-term trend. We'll have to see that for a longer period of time. And then here it breaks it down by county in the Northwest region, and while the total number of new cases each day is on the decline, this illustrates the areas that have the highest growth in new cases. And so if you start with Baxter County, which we were there, they've had this is in percentage, and so they had very few cases, so it's easy to get to a 35% increase if you start with a very small number of cases. But they've had a growth. Benton County, you can see, has reduced their growth. You've got Boone County, which is a new county, and those are small numbers, high level of growth. And so the other one over there is Polk County, you can see, as well as Newton County, and those would be small numbers, except Polk County is one that has had a consistent, steady growth that we want to watch more closely. I think that concludes those, and with that, let me ask Dr. Romero to come and make his comments, and then I'll introduce the administrators.
Thank you, Governor, Drs. Shackelford and Alto. So I'm just going to add a little bit more depth to what the Governor has already provided, and also then provide some county-specific data. So of the 591 new cases, 584 were community cases and 7 were correctional cases. Yesterday we were asked about where the correctional cases increase had come from. It comes from the Ouachita facility. Hospitalized individuals, as mentioned, has decreased, and so have individuals on ventilators. We are down 3, so at 107 individuals. We've had 6 additional deaths for 380, and to date we have 27,990 Arkansans that have recovered. Our active cases at the moment are 6,876. This is comprised of 140 nursing home patients, 916 correctional cases, and 5,820 community cases. Our total number of Arkansas cases are 35,240. The testing data has been provided. Just let me say that our percent positivity for the last tranche of data was 5.8%, but the Governor has explained the difficulties that we had with regard to that. So turning specifically to data from Washington County, the overall percent positive rate here in the county is 22%. We have an unusual distribution of our cases here, unusual in that it's not following the national trend, in that most of our cases, that is 72% of our cases, are in individuals that are 44 years and under, which actually points to the fact that these are individuals that are engaged in work and are acquiring the disease in the community or possibly spreading it at their work sites. Interestingly, and we've noticed this in a number of counties here in Arkansas, we have a higher rate of children that are infected. And in our county here, we have 17.9% of the cases in children. The national trend is about 2 to 3%. And again, this represents most likely spread within tight-knit family units. Lastly, let me say that a little more than 11% of the deaths reported in our state have come from this area, from this county, 39 deaths. And approximately 60% are in the Marshallese population for a number of 23 cases. So I'll end it there and turn it back over to the Governor.
Let me thank again Larry Shackelford for hosting us today at Washington Regional Medical Center. Larry, why don't you give the report, followed by Eric Penalto.
Okay, Governor, thank you. Thank you to your team. I believe this is the 3rd trip to Northwest Arkansas that you all have made since this pandemic began. I am very pleased to be here on behalf of Washington Regional, and really on behalf of those frontline healthcare workers. So thankful, Governor, that you took the time and met with them, that they are tired. This has been an ongoing battle, and those frontline healthcare workers are out there every day making a difference, taking care of our patients. I want to also thank your team, Arkansas Department of Health, for the support. I think the Arkansas hospitals are very pleased with support, and thank you for that. On behalf of Washington Regional, we are thankful that we have National Guard workers here on site. They are here and helping us in our call center. We have been able this week to return 8 nurses to direct patient care. We understand they're going to be here for a time, for 30 days. Our hope during that 30 days is we'll in fact see hospital volumes decrease, and then we'll be able to pick that up from that standpoint. Just to give you an idea, our call center in the first 15 days of July managed 15,825 phone calls. So that is a really big task. As the governor mentioned, we saw about a week and a half ago a spike. We had over 40 positive COVID patients in our hospital. Of those, 16 were on vents. In addition, we have seen a high number of ICU patients. And I'm pleased, as the governor mentioned, is we have been able to meet that. We've been able to continue to do our core business and take care of those COVID patients as well. So our trends this week are better. As we have seen the number of positives in Washington County decrease, what we believe we're beginning to see now is a decrease of those sick patients that are coming. So with that, thank you, and I'll let Mr. Pinalto provide an update.
Thank you, Governor. Thank you, Dr. Romero, both for being here. Thanks for your ongoing support. I'd like to echo the thanks that the Governor and Larry both talked about healthcare workers. This is a very difficult time for all of those in healthcare, our frontline staff, our doctors, our nurses, as they experience both a surge in COVID patients, very sick patients that they're taking care of, but also we've seen large numbers of non-COVID very sick patients as a result of people delaying care. So my first priority might be to continue to encourage people, if you're sick, seek care. Seek care at your doctor's office, seek care at your hospital. Don't delay. It's much easier to take care of you in a non-emergent situation than in an emergent situation. So please seek care wherever you are in the state. Also, we're encouraged at Mercy to start to see our numbers come down. We saw the early stages of the COVID surge here in Northwest Arkansas beginning in mid-May. It increased pretty much until about 2 weeks ago, where we peaked at 45 COVID patients in our hospital. Since that time, we've seen the numbers come back down to the mid-20s, and we're very excited about that. I think we saw a peak in Northwest Arkansas of 120 hospitalizations among all the hospitals, and that number's come down quite a bit as the governor's numbers showed. Another thing, I would like to thank all of the healthcare systems in Northwest Arkansas for the collaboration. It's allowed us to continue to keep patients in Northwest Arkansas, take care of them for both COVID and non-COVID. So special thanks to Larry and to Denton Park at Northwest Medical Center. We've been able to manage safely and effectively the care here in Northwest Arkansas. So Governor, I'll turn it back to you.
Secretary Preston and his team have been very busy dealing with the unemployment insurance and pandemic unemployment assistance payments, but also we're continuing to recruit industry in Arkansas. In fact, in the last 2.5 weeks, we've made 6 announcements that involve over 1,400 jobs in Arkansas. And so today was a part of that, but I wanted Mike Preston to come, Secretary of Commerce, to make some comments about that.
Well, thank you, Governor, and Larry, thank you for having us. It's good to be back in Northwest Arkansas. Feels like we've been away for too long, so it's good to get back out and see folks and see what's going on here. And I do want to touch on the unemployment and the pandemic unemployment, some issues related to that. But it is nice to share some good news and see, our economy starting to move in the right direction. Granted, we got a long ways to go, but the announcement came out last week. We're down to 8% unemployment statewide, a full 3% percentage points better than the national average. Never thought in February we'd be saying 8% unemployment was good when we're sitting at 3.5% unemployment. So we do have some work to do, but these announcements certainly help. And I do want to give credit to the Economic Recovery Task Force that the governor put together. Big thanks to Chairman Stuart Walton and his leadership. We're starting to see some of the recommendations coming out of that task force starting to be implemented. We're starting to see these businesses get back to work and seeing our economy try to recover and rebound. And thank you to Hunter Yurichek, who serves on that, who is here today and represents the student athletes and the student body and the coaches and the folks at the University of Arkansas. Brings a perspective from that to our task force and good conversation about what's going on campus there. And that's a big part, and we're looking forward to what's coming there. So as the governor mentioned, we've been able to start getting back to proactive recruitment and working with our industries in the state to help them expand. Just to highlight a couple of those announcements, last week we had the big announcement in Little Rock at the port, 1,000 jobs associated with a new Amazon distribution facility. In Fordyce, Arkansas, 31 jobs with the company Signode in manufacturing. Gerber and Fort Smith announced another 50 new jobs at their facility, along with a $30 million investment. Just yesterday, a company called SCA Pharma in Little Rock announced a 180 job expansion with a $10 million investment. As the governor mentioned, we spent the morning over at Lazy Boar in Siloam Springs, where they're adding an additional shift that'll bring them up an additional 125 employees. And then down in South Arkansas in Crossett, a company called Synergy Cargo. So you can see this is across the board in industry, across the board in the state, regionally. That's good news. Almost 1,500 jobs, as the governor said. We're heading in the right direction, but again, still much more work to do. But I appreciate all the team at the Department of Commerce who's worked so hard to bring those in, and our local economic development partners. And I know Steve Clark is here representing the Fayetteville Chamber and their partnership. So appreciate all them and the continued efforts that they're doing to support their businesses. Related to the unemployment insurance, I just wanted to mention that we still see the numbers continuing to trend down in the right direction. We're at about 92,000 continued claims this week. We've seen that drop every week since, I guess we reached the peak about May 9th at 122,000 continued claims. I do want to highlight and point out at the end of the week ending July 25th, which would be the end of this week, is the last week for the pandemic unemployment compensation. That's the additional $600 that the federal government made available via the CARES Act to those on unemployment and on the pandemic unemployment assistance. So right now that is set to expire. I wanted to make sure employers and employees who might be benefiting from that are aware of that. Congress is looking at this week in part of their new negotiations of a new CARES or new stimulus bill. So we're paying close attention to what that means. And I know there's a lot of debate in Congress happening right now, but as it stands, that will be set to end the week ending July 25th at the end of this week. And then just wrap up, still fraud continues to be an issue that we're dealing with unemployment insurance. Our team is working very hard to combat that. We've hired additional folks on to try to get through the backload. We've got about 20,000 claims that are under review status for potential fraud. If you've received a notification, please follow the directions there, provide the information that has been requested so we can clear that up as quick as possible. And if it's not a fraudulent claim and you're due that payment, we can get you that payment. Or if we recognize that it is fraud, that we can go ahead and execute a fraudulent claim case and pursue the proper legal course for that action. But you should have that information if you were one of those individuals who was impacted by that, and contact the Department of Workforce Services so we can help. Governor, thank you. I'll turn it back over to you.
Thank you, and with that, we'll take questions. Yes.
First and foremost, you mentioned some of the death numbers earlier. The latest reports from Washington County and Benton County coroners is saying that it's 57 deaths in Washington County and 67 in Benton County. I know that we've talked about the lag but this would indicate a pretty significant lag. What seems to be the problem in communication between them and the ADH?
Are you saying there's a discrepancy in the numbers between what they're reporting and what the Department of Health is reporting?
Yes, sir.
Yeah, I think that there would be a lag. I'll ask Dr. Romero to comment on that from a Department of Health standpoint. But, you know, whenever the coroner or the death certificate is filled out, it has to be filed, it has to be put into the Department of Health system. Sometimes there's a delay in that. But with that, Dr. Romero, do you have anything to add?
So there is clearly a lag. We're still experiencing it. I'm still getting calls from hospitals reporting deaths that have occurred more than 72 hours prior to the day they're calling me. So there isn't yet a seamless way of transmitting all this information to us. We are behind. We know that there is a discrepancy in there. And I think that delay explains a lot of it.
Just to follow up with that while you're up there, Dr. Romero, I know that fax machines are being used from the ADH in this communication here, and one of the coroners asked if email could be used to distribute some of this information, specifically with post-mortem cases. Is that even a possibility to use email?
So I think that will depend on the issue of HIPAA, right? The maintaining the confidentiality and those issues. I would need to talk with my staff to see if that can be done. But certainly it is an option, and we can look at that.
Yes.
Great to see the new case numbers going down in our region, but when we look at the state website, specifically for Washington County, it looks like the positivity rate still most days is above 10%, that 10% line we look at. Some days up in the 20% range. What does this area need to do differently to get down closer to where the state average is?
Thank you, and that's an excellent question. And the answer is that we all need to do everything we can to stop the spread of the virus. And there's certain things that the state does, but there's things that each individual has to do that nobody else can do for them. And that is to socially distance, to make sure that you wear a mask in compliance with the mandate of the city and the state, and probably the employer and the place of business. And so exercise personal responsibility. And as we get closer to the school time, you'll see that positivity rate go down. These are proven steps that do have a beneficial impact on the spread of the virus and the reduction in the number of positive cases. So that's what we need to do. And I know that with the decline in hospitalizations, that's starting to come around, but clearly that's too high of a positivity rate. And we want to get that down so people will feel safer that it's a good environment to, whether it's to go to school or whether it's to go to work or whether it's to go to the grocery store. And that's what we want to see done. Yes?
How many of today's 591 announced new cases went into the 5.8% positivity rate? Because if we just did the math, we get a 15% positivity rate. So we're not including all of today's new cases. So how many of today's new cases actually went into today's positivity number?
And I don't have the answer to that. Dr. Romero, can you shed any light on that?
I can.
Okay.
So the total number would go into that from what we have. Now, that positivity rate, that 5.8%, is that what you're referring to?
Yes.
Okay, that represents what we have from both those tests performed at the health department, those tests performed at UAMS, and those tests performed outside of that. So they would all go into calculating that number.
All the positives?
The positivity, those positives from that case, yes, from that tranche.
15% positive?
I haven't done the calculations myself, so I would have to look at that. You know, our positivity rate has been true, and we haven't varied how we've calculated that. So I would assume that there's no variation in what's being entered into that.
We will look at that. Thank you for raising it. Yes?
The high positivity rate in Washington County, I thought that might also indicate that there's not enough testing being done. So what is the state of testing in Washington County? I know that was an issue a few weeks ago. I'm wondering if you've seen any improvements.
Actually, it's a very good observation that sometimes you have a high positivity rate because we're targeting through our Department of Health a population or a setting in which we know there's a large number of cases. And so obviously you're going to have a high positivity rate in that case. The other side of the equation is the more you test to the general population, then it's likely that that positivity rate will come down. And so the more you test, then in an ideal circumstances, that positivity rate will be lower because you're testing more that might be asymptomatic and not just demonstrating some symptoms. So that's one of the reasons that we would like to have the testing at a higher level. We've set those goals. We're trying to accomplish that, but we've got a challenge. Even though we're testing at a good level, it's not as high as we would like to see. Yes?
Have the Washington County Health Unit and the Benton County Health Unit having longer hours, has that made a difference at all?
It has made a difference in terms of taking some pressure off of Washington Regional Medical Center that everybody was going to, that took their staff away from patient care in some circumstances. So we tried to move it more to the health units so that it would put the burden on the public health laboratories. We expanded the hours, and I think that has relieved some pressure. Yes?
At the end of March, we had projections that showed Arkansas's peak for hospitalizations and total numbers in midsummer at some time around June. At that time, you started closing down businesses to sort of curb that. Since then, you've reopened some businesses, and we have new projections from UAMS that talk about the peak at the end of November. Is there any chance that you go back to that strategy of shutting down businesses, and if not, why?
Every option is always on the table when you're dealing with an unpredictable virus. And so these decisions are made day by day based upon the data that we see and the guidance from the Public Health Department. And as we've pointed out that, you know, the rise in cases that we've seen have been from broad community spread or across the state and not tied to a lifting of restrictions. We did have some concerns about the operations of some bars, and so we tightened up our enforcement of that. And yes, if we see a connection, a correlation, where it's adding to increasing cases because of lifting some of these restrictions, we will revisit that. Whenever you look at, you know, the trend line, you know, I think we did increase our testing, but we did see an expansion of our cases, and it was simultaneously to when you saw the expansion of cases across the South. So I think they'll have to have some epidemiologists study that a little bit more as to all the cause and effect. But every option is on the table in the future. If we have to take additional steps, we hope we don't have to do that. We'll take a couple here, then we'll go remotely. Yes.
So Dr. Romero just a little bit ago talked about how there could be some indications that this is spreading at work for some people. Looking at the poultry plants, I know there's been a lot of praise for the administrations of these places, but even looking at the CDC report that came out, I think many of the workers have a different opinion. There have been plenty of reports of folks who tested positive and then had to return to work within 3 to 5 days. There's a viral story going on Twitter right now for 3 days. What goes into making sure that folks are safely able to return to work and still have quarantine period if they're working in poultry plants?
Well, if they test positive, then they're supposed to isolate or quarantine for 14 days in accordance with the public health guidelines. And, you know, my experience with industry is that's exactly the guidelines that they are following. I've visited with both sides of the equation, and whenever you look at one industry and they have a COVID coordinator that does the education in the workplace, when they do the testing that's in there, They've taken those steps and measures. I think they've made progress, but the challenge is not just the workplace, but it's also where they live, how they live together in a community, and where they go to the grocery store, and where they wear a mask. And so it's an education, not just the workplace, but it's an education for life. And so that's what we all need to be engaged with as a community. And we are taking very seriously the CDC recommendations and asking for a more intensive effort and funding a more intensive effort with those populations. One here, then we'll go remotely.
Thank you. You mentioned talking to the nurses and how much stress you saw on their faces. Assuming this pandemic isn't going anywhere for a while, what can be done to help these nurses, to give them more resources, to help them out so that stress doesn't begin to take a worse toll on them?
Well, that's a question I asked them with as well, and you know, I know the hospital is recruiting new nurses. New nurses need to come into the profession. They're hiring new nurses so that we can give breaks to those that have been engaged in this for a number of months. One nurse came on board, I think it was a month and a half ago. So not the beginning of the pandemic, but in the middle of it. And I'll invite Larry if he has any additional comment, but I think that's the strategy is, one, let's relieve the burden of the number of cases they're having to deal with. And secondly, we need more in the profession to give them the breaks that they need. One of the reasons we brought the National Guard in to relieve some of the pressure, to allow them to do some of the direct work with the patients. Let's go remotely.
Yeah, Governor, this is Andrew with AP. Had a couple questions for you. Wanted to see just generally on the UAMS modeling, wanted to see if you had a just comment on their latest modeling, and also wanted to see how much is that model impacting your decision to go forward with schools reopening late next month. And the second question I had was just following up on that statement yesterday from the Arkansas chapter of the American Academy of Pediatrics. Wanted to see if you've had a chance to take a closer look at that statement, if you had any response to some of their recommendations, including the more stringent masking requirements for K through 12, clearer guidance on social distancing, and some of the funding proposals in there.
Well, Andrew, in terms of the Academy of Pediatric Physicians, I have read the report, and as I read the report, I saw that a number of the things that we have implemented, we have addressed. Others are ones that need to be discussed and see if they should be addressed. So it was a very thoughtful letter. I've reviewed it, and we're going to take those suggestions and see which ones should be implemented. In terms of the mask requirement, we have, you know, if their suggestion is that we should have a mandate for all the children in the school at all hours that they should wear a mask, I don't think that's a good idea, because if you have a class of 28 students and you put them in the gymnasium so they can socially distance adequately, then and there's a more than adequate space from the teacher, then they're getting a break from wearing a mask right in the middle of the day. I don't think that's the decision we ought to make in Little Rock. I think there ought to be some flexibility for the social distancing and the environment that the students are in. So some schools have made that mandate. Others are looking at some of the social distancing requirements, but I think there has to be some flexibility there. We'll continue to look at it, but I talked to the school administrators today, and I think they understand the need for having some local flexibility on that point. There was one second part to your question, Andrew. What was it?
Yeah, thank you. And the first part of it was just your response to the latest UAMS modeling, and wanted to get an idea of how much influence is that having as you're looking at schools reopening late next month, your decision to go forward with that.
You know, we pay attention to every piece of data and guidance that we can get, and that's one information, that's one model. I mean, there's multiple national models, and it's a moving target. When they first started, well, not first started it, but the model before the last, it was an August 30th peak that went to October, and now it's in mid-November. And so it's totally shifted. I don't know exactly what changed that, but I presume it was the fact that we flattened our cases, and so they extended that out. And so it's information. You know, we pay attention to it, but we also realize that they changed the model based upon the current data, and that current data is how we're making decisions as well. And you know, we have the masking mandate in place that the UAMS modelers pointed out could start having an impact in 2 weeks from Monday. It could have an impact sooner than that. And so that'll change their model as well. So they're going to change their model, and we're going to continue to use data to make decisions. One other question remotely.
Yes, Governor, Mike McNeil at MagnoliaReporter.com. Governor, there's a high possibility that many school districts will operate with split schedules this fall, with only half of the students attending on certain days. Is any provision or state funding being considered to assist working parents in securing childcare on the days when their students are not in school?
Well, that's why we need in-classroom instruction. We need to have a school that's meeting. It provides a wholesome atmosphere for the students. It's a safe environment for them. We obviously need to have it safe for the teachers, but that's our goal, because whenever you start moving to you know, a virtual environment, then every working parent has to scramble around for somebody to watch the child. If they're doing virtual at home, many times it takes a parent to help to guide the young child in that as well. And so the ideal is the in-classroom instruction. We recognize there's going to have to be shifts from time to time to a blended environment, to utilize online services as well. We don't have a one-size-fits-all at the state level. We do provide some flexibility with some very specific guidelines, and I've heard some people make a comment that, well, there's got to be a state plan in place before we start school. Well, there is a state plan in place, and that state plan involves some local flexibility with some very serious guidelines from the state. And so I think that's the right model. If we need to adjust it as time goes on, we'll take a look at that.
But Governor, is there any provision for state funding being considered to assist working parents with securing child care? I don't really think you've answered the question.
That's fair, and the answer is not at this time. We do have, let me change that a little bit. We actually have a significant amount of money set forth in DHS for child care that working parents can access. Now that's for child care, but is that what you're speaking of, child care?
Yes.
Well, so there is money for child care. But that doesn't help a parent who needs to go to work with their children at home learning virtually. That doesn't help. That's not the child care that we're paying for. I think it's more in a child care setting. Just right here in the room.
Sure, thank you. Staying on the topic of schools, I believe Dr. Romero said the percent of cases in Washington County that were children was about 18%, a little higher than what we would expect to see. Does that, with that being said, should school districts in this county take a different approach to in-person classes than counties where that number may be lower?
We have set up where you start school, and then if there is a positive case, then the Department of Health will help guide the response to that. And we have very specific guidance depending upon, it's a relevant factor. The percent of positivity in the community helps us to know what the response should be. So it is relevant. It helps guide what the response is if you have some positive cases in the school. Doctor, I've been talking a little bit. Do you have anything on that?
I would like to add a little bit.
All right, please.
Exactly. I also think it's important to bear in mind that children are not spreaders. So they've not been shown to be very effective in spreading the virus, and that's particularly in children under 10 years of age. Newer data suggests that those children 10 and older may be more capable of spreading it, and similarly as you get into an adolescent, an older adolescent like an adult. So in essence, they're not high risk for anyone in particular or for spreading it in their classroom environment the younger they are.
Good question. Yes.
Yes, sir. Have you been able to review the president's memo that was sent today on potentially excluding undocumented immigrants from the census apportionment count? Arkansas United, advocacy group here, had a meeting today talking about asking you and your administration to meet with minority groups, Hispanic, Marshallese, Latinx communities about the importance of the census.
I have not read the president's memo. I have read the news story on that, and I'm going to be actually in our Friday update, intend to have our census complete count committee there to talk about the census. We can review that, but I'd probably need to see a little bit more of the history and the legal requirements on the census before I make a specific comment on that. Yes.
So Dr. Romero just brought up a point about 0 to 10 and 10 to 17-year-olds behaving differently, the virus behaving differently. Has the state thought about breaking that age group up in the data that it provides so that school districts can make better decisions based on those different age groups?
You mean like the number of cases in a different age group?
Yes, we just have it as 0 to 17 right now. And is the school districts, are they getting city level data from you guys broken down by age groups for them?
Dr. Romero, did you hear that question?
I did.
I think that's just one we're going to have to think about. You know, it's the more specific information, the more helpful. Maybe it can be entered in a fashion that can be more useful, and we'll take a look at that. Let's see here. Yes.
Governor, I don't think I was really clear in my last question, so I was going to apologize and see if I could clarify it a little bit. Whenever I said that there were folks who were being asked to come back after 3 to 5 days, they are saying that superiors are telling them to do that, as in, you know, they are having to do that. So is there a way to check sort of the autonomy that these multi-plans have?
You'd have to give me the specific case with a name and an employer, and if they're not following the rules, be glad to check into it. But that's without information. All I know is the general rules that the employers I know are expected to follow and are following. Yes.
I know some tests are still taking 7 to 10 days to come back, but it's also all over the place. I've also heard people who've gotten tests back in 3 days. Any updates on that, on whether that time will be shortened? And do you think it's dissuading people from getting tested when they have to wait 7 to 10 days to find out the results?
Oh, it's hugely problematic if you have to wait 7 to 10 days for a test. It's a problem in our contact tracing. It's a problem in how much time they're off work. What do they do when they're waiting for those results? They quarantine. All kinds of issues whenever you do not have timely results. And that was very fair of you, because a lot of people I talk to are getting it within 1 to 2 days, 2 days, 3 days. Then you have others that have a longer period of time. The same experiences in the hospital environment. Some of it depends upon who the commercial lab provider is, who you're going to. Sometimes you have to switch because one's taken too long, another one has less of a backlog. So we have to adjust as a state, trying to find the best sources for that from our standpoint. And of course, those are individual clinicians' decisions too as to who they send the lab tests to. It is a problem. We're pushing every lever we can to change the ingredients there and to get a better result. All right, is there one final question remotely?
Yes, Governor, good afternoon. It's Neil Gladner in Hot Springs. Thank you. The combination of lower testing numbers and additional contact tracers, is that helping the state health department get caught up on the contact tracing? And can you give us an update there?
Generally, I can give you an update, which is absolutely yes, because the first contract was with General Dynamics. They have beefed up. They've hired their staff. They are actually working. Well over 1,000 cases have been assigned to them. And then, as soon as we have legislative approval, the second contract can be initiated, and they'll be brought on board very quickly as well. So yes, there is relief there. That's all the level of specificity that I can give you. One last question.
We've heard that UAMS has moved some of their programs to online only, specifically their pharmacy program. Is that the case?
That they've moved it to some of their programs to online only. I couldn't make a comment on that. It certainly makes sense in this environment, but I don't have any comment there. All right. With that, thank you very much for allowing us to be here in Northwest Arkansas today, and y'all have a great day. Thank you.